So one of the most common reasons that patients will come to see me in the clinic is for skin cancers or concerns about skin cancer. There's essentially three types of common skin cancers that we will see. The first is basal cell carcinoma. This is relatively non-worrying form of skin cancer in the sense that it won't spread elsewhere in the body, but it can be very locally destructive, and it's important that it's recognised. The second type of skin cancer is squamous cell carcinoma. This is slightly more concerning in that it has the potential that it can spread. It will generally look like a rapidly growing lump. It may look like an area that's bleeding or ulcerated in comparison to basal cell carcinoma, which usually is slow growing and might look like just a whitish nodule or a pearly lesion. Now, the more concerning form of skin cancer is melanoma. This is the most serious form of skin cancer. This will most commonly look like a dark mole or a dark mark on the skin, and often something which is changing in appearance. And the reason that this is the most serious is that it does have the potential that it can spread. And therefore, we do want to pick it up at the earliest stage. And that's actually the case for all of these skin cancers. The earlier that we can pick them up, the better the prognosis, the less tissue needs to be removed, and the less risk there is that they will spread. So how can we achieve this? How can we detect skin cancers early on when the prognosis is better? Well, really the key here is checking your skin. And a good way to do that is to get a mirror in front of you, have another mirror that you're using to check your back. Every few months, just do regular check of all of your skin, get used to what your skin looks like, get used to what is on the skin. And another thing that you can do, which is very helpful in that context, is actually to take some photographs, get somebody to help you with the back. Take photographs of all the body areas, and then you'll literally just repeat those photographs every few months. You're putting them side by side. You're looking for anything new, anything changing. That's the things that would need to be checked. Now, when we're talking about pigmented skin lesions, there's a set of criteria which we can use to help us to understand which skin lesions we need to be more worried about. This is the A, B, C, D, E criteria. A means that the mole is not symmetrical. It's an asymmetrical mole, and one side is not a mirror image of the other. B is border irregularity. Rather than a nice smooth border, you've got an irregular or jagged border. C is colour variation. Rather than a single flat brown colour, you might have multiple shades of brown. You might have redness. You might have whiteness or blue, and multiple colours make us more concerned. D is diameter greater than ½ centimetre, and E for me is actually the most important, evolution. This means that it's a new lesion or that it's a changing lesion. Of course, not every single skin lesion which meets one or more of these criteria is going to be a skin cancer, and it can be quite difficult to then distinguish what is a slightly irregular mole versus a more worrying skin cancer. And a good way to do this, if you're having this difficulty, is actually to see a dermatologist and have a full skin check, and then you know that at that point in time, whatever's on the skin is fine. Take some photographs yourself, and then all you need to do really is monitor for any change, because anything changing is something that needs to be checked. But if you know that it's all fine at one point in time and it's still looking like that, then you can be reassured.